Thanks for watching. This is YouTube Medical University. This time we're talking about shingles. It's said that 1 in 3 people will get shingles by the age of 80. The symptoms can be very painful, and in some cases the nerve pain can last for a year or two, making it very difficult for some people. Also, it's not widely known, but shingles can cause serious complications such as vision problems, hearing loss, or facial paralysis. These severe complications do exist. In fact, if shingles is detected early, or if you know about the types of shingles that require special attention, you can lower the risk of complications by going to the right hospital and getting proper treatment. So, in this video, we'll cover everything you need to know about shingles, including its characteristics, early symptoms, complications to watch out for, and the latest topics of interest. We'll discuss the effectiveness of the shingles vaccine and if those who've had shingles need it. This video will give you a solid understanding of shingles, covering these key points. On YouTube Medical University, we responsibly share videos from a doctor's perspective that can help you become healthier starting tomorrow. If you'd like, please subscribe to the channel so you don't miss any new videos. Now, here's today's agenda. In the first section, we'll talk about the characteristics of shingles. In the second section, I'll introduce the dangerous types of shingles that you should be especially careful about and see a doctor immediately if you notice them. And in the third section, we'll discuss the painful how to prevent postherpetic neuralgia after shingles. In the fourth section, we'll discuss the vaccine that's gaining attention and may soon be free through public funding. I'll explain the latest information about the shingles vaccine and who should get it. So, first, in the first section, I'll give a simple and easy to understand explanation of the characteristics of shingles. Seeing is believing, so please take a look at this image. This is a skin rash caused by shingles, which appears on the skin. They're red bumps. The pain is intense, and it's characterized by a sharp throbbing sensation. In fact, 1 in 3 people will develop shingles by the age of 80. A key feature of the rash is that it appears on one side of the body. As the name suggests, shingles tends to spread in a band-like pattern across the skin. That's the tendency, and if it were just the bumps on the skin, it wouldn't be so bad, but the throbbing, sharp pain, and even just touching it can cause a burning, stinging sensation. These severe symptoms can occur, and sometimes you may also develop a fever. Another characteristic of the rash is that it consists of both blisters and a rash. This means that blisters will form. As time passes, these blisters may break open and become wet as shown in this image and then scab over, gradually leaving dark marks or scars for some people. So, why does this happen? Why do these red bumps appear on only one side of the body? If you understand the reason, it's easier to remember and less likely to forget. Actually, it's caused by the chickenpox you had as a child. Chickenpox is well known for causing a fever and red bumps all over the body in children. The truth is, the chickenpox virus stays dormant in your body, and when your immune system weakens, or as you get older, the virus can reactivate and cause a rash again. This is called shingles. That's why it often happens when you get older, when you're tired, or when you're under stress, or when you're taking medication that suppresses your immune system. It's during times like these that shingles is more likely to appear. By the way, cold sores or herpes that appears on the lips have similar characteristics. These viruses are related, so they share similar features. The reason the rash appears in a band-like pattern is because the virus hides in the nerves. Our nerves branch out from the spinal cord, extending to both sides. Since the virus reactivates in one nerve, the rash appears on one side of the body along that nerve. It's easier to understand when you know the reason. Now, let's move on to the second period. In this session, I'll talk about the dangerous characteristics of shingles and what happens when it appears in certain areas. If you have shingles, be sure to go to a proper hospital. That's my main point. I'll introduce 2 dangerous types of shingles. The first affects the area around the eyes. This is shingles. Please take a look at this image. If you see bumps like this around your eyes, there is a risk that your vision could deteriorate. So if you have shingles around your eyes, make sure to see an ophthalmologist. By the way, it's easy to notice around the eyes, but it can also appear on your forehead or nose. Shingles in these areas are controlled by the same nerves as those near the eyes, so it can appear on the forehead or nose too. Please remember that if you have shingles in these areas, you also need to see an ophthalmologist. If you know this early, you can prevent vision loss. Please keep this in mind so you don't end up in that situation. Dangerous. 2 types of dangerous shingles exist. The second is shingles near the ear. In this image, the facial muscles on one side seem weak and drooping, don't they? Actually, shingles around the ear can cause facial nerve paralysis. That's something that can happen. Shingles in the ear can cause these kinds of symptoms, and in rare cases, it can even develop inside the ear canal. So if you feel something strange, if you have ear pain, it's important to check inside the ear as well. Shingles in the ear affects the facial nerve, so it can cause facial nerve paralysis. You may lose strength in your face, or risk a decrease in hearing. That's why if you get shingles around your ear, you need to see an ear, nose and throat specialist. This might be a bit complicated, but because of the way the nerves are connected, shingles that appears in your mouth or on your tongue should also be checked by an ear, nose and throat specialist. It's important to get proper treatment to prevent facial nerve paralysis or hearing loss. See an ophthalmologist for shingles on your nose and an ear, nose and throat specialist if it's in your mouth. Without this info, knowing where to go can be confusing. You may not get proper treatment. That's why YouTube Medical University values knowledge as a powerful tool. Knowing these things helps protect your health. I'm sharing this important information as a doctor. I'll say it again, if you found this even a little bit helpful, subscribing to the channel would really encourage me. Now in the third period, I'll talk about postherpetic neuralgia, the long-lasting after effect of shingles and how to prevent it. Is there anyone around you who has been suffering from long-lasting pain after having shingles? If you know someone, you likely can't forget it because they must be experiencing very painful symptoms. If pain persists for over 3 months after shingles, it's considered a complication. Even after the rash heals, some still feel burning or needle-like pain in that area. Even clothing touching the skin can cause severe pain. Some people suffer so much they can't sleep or focus at work, sometimes forcing them to quit. I've seen many endure these symptoms. Actually, postherpetic neuralgia after shingles is not a rare complication. About 35% of people over 80 years old, which means 1 in 3, develop this complication. Age is not the only risk factor. People who have severe symptoms of shingles and those who are taking immunosuppressive drugs are also more likely to develop it. However, there are effective ways to prevent it. One is to start treatment for shingles as early as possible. Another way to prevent postherpetic neuralgia is to get the shingles vaccine, which I will introduce next. I will explain the treatment and vaccine for shingles in detail in the third and fourth periods coming up. Once you develop postherpetic neuralgia, the only treatment available is symptomatic therapy. Some people take painkillers, receive anesthetic infusions, or apply anesthetic creams. And if the pain is really severe, there is a procedure called a nerve block, which targets the nerves that sense pain. In some cases, anesthesia is applied directly to the nerve itself to relieve the pain. In fact, I have had patients who experienced such severe pain that they ultimately had to use medical narcotics just to get by in their daily lives. It's definitely best to avoid developing postherpetic neuralgia if at all possible. So, regarding the shingles vaccine, which is one of the preventive methods, since it's still not widely known, I'd like to explain its effectiveness, the types and characteristics of the vaccine, and who should consider getting it. The shingles vaccine is generally recommended once you turn 50. The details may vary depending on underlying health conditions. By getting the shingles vaccine, you can prevent getting shingles. Data shows the risk drops by up to 97%, making it highly effective. Even a decade after vaccination, the risk remained 72% lower. It's a vaccine with lasting effects. However, the reason it's not widely used is because the shingles vaccine is an optional vaccination, so basically you have to pay for it out of pocket when you get it. And since it's not a cheap vaccine, the reality is that it still hasn't become widespread. Some municipalities are running campaigns with subsidies that cut vaccine prices in half or offer similar discounts. Some municipalities are like that. The earlier risk reduction is due to the new 2-dose vaccine. Some vaccines need just 1 dose and their effectiveness can differ, which can be confusing. I'll soon use a chart to explain the vaccine differences. The live attenuated vaccine on the left is the original one used. The vaccine that needs only 1 dose is newer and more effective. On the right is the inactivated vaccine, which needs 2 doses. The live attenuated vaccine and the inactivated vaccine differ in cost. Many hospitals offer the live vaccine for under 10,000 yen per dose, while the inactivated vaccine usually costs about Each inactivated vaccine dose costs about 20,000 yen, so both typically total 40,000 yen. That's a big difference, right? So regarding their preventive effects, For the live attenuated vaccine, it said that for people over 60, getting the vaccine reduces the risk of shingles by about half, or 50%. On the other hand, the inactivated vaccine, when given to people over 50, has been shown to reduce the risk of shingles by an impressive 97%. There's a clear difference in effectiveness. As for how long the effects last, the newer inactivated vaccine is said to provide protection for about 10 years, while the live attenuated vaccine generally is said to last for about 5 years, and after 5 years its effectiveness decreases. Also, as I mentioned earlier, this vaccine not only reduces the risk of shingles but also helps prevent the nerve pain that can follow. I mentioned that it is effective for that as well. Regarding that effect, the live vaccine was able to reduce the risk by 67%. As for the inactivated vaccine, in that study no cases of postherpetic neuralgia occurred, meaning the risk was reduced by 100%. Let me share my opinion here. Although the cost is high at 40,000 yen, one way of thinking is to go ahead and get the highly effective and long-lasting inactivated vaccine twice. However, since the price is quite different, first, the one that lasts about 5 years, you could get the live attenuated vaccine, then in 5 years either get it again or switch to the inactivated vaccine. In 5 years the shingles vaccine might also be publicly funded and free. Please choose your vaccine after considering your options and budget. Regarding side effects, the inactivated vaccine given twice, there's a higher chance of fever or pain at the injection site as side effects, so please consider this when deciding. Now let's review what we've covered. Shingles is a condition where 1 in 3 people over the age of 80 develops painful red bumps on one side of the body. And this happens because of something you had as a child. It appears when the chickenpox virus becomes active again, and there are dangerous aspects to shingles. If shingles appears near your eyes or ears, see an ophthalmologist or ear, nose and throat specialist. Shingles may also cause lasting pain. This is called postherpetic neuralgia. These symptoms include pain or tingling that lasts for more than 3 months after having shingles, as well as stabbing or burning pain. 1 in 3 people over the age of 80 experience this, and those with severe symptoms or weakened immune systems are also affected. There is a tendency for these people to be more susceptible, and in order to prevent this, it's important to start treatment early. I explained that the shingles vaccine is effective and mentioned 2 types, the live attenuated and the newer inactivated vaccine. Since cost and effectiveness differ, please consider which you prefer or if you want the vaccine at all. Please share your thoughts in the comments section, as I think it will help others make their decisions. So finally, I will explain in a Q&A format some of the questions I often get from patients when I diagnose and treat shingles in my outpatient clinic. The question is, what is the treatment for shingles? The answer is this. Generally, you take oral antiviral medication to suppress the shingles virus. The treatment is completed by taking the medicine for 1 week. It's important to start taking the antiviral medication within 3 days of the onset of symptoms. It's said that the medication is effective when taken during the stage when the virus is increasing, so if you take it after too much time has passed, it won't be effective. Taking it within 3 days is said to help the rash heal better and also helps prevent postherpetic neuralgia. For example, even if shingles appears on a Friday, if you wait until Monday to see a doctor because you're busy today and 3 days pass, your symptoms may get worse. That's why it's very important to go to a hospital as soon as you notice the symptoms. Also, since this is medication, there can be side effects. The medication for shingles puts a burden on the kidneys, so the dosage is adjusted according to kidney function. This medicine is still expensive, and compared to regular medicine, just 1 week of treatment usually costs several thousand yen. It's an effective medicine, so I really want you to take it, but those are some of the considerations. I also want to let you know that there are disadvantages in terms of cost. Here's the second question. Do the symptoms of shingles appear at the same time? In many cases, pain appears first, and then a few days later, a rash or bumps on the skin may develop. So, based on my experience, sometimes it feels like... The patient says, "Doctor, I have a stomachache," and reports abdominal pain. We ran various tests to find the cause. but couldn't find anything specific. I thought that maybe in a few days red bumps might appear and it could turn out to be shingles. So I told the patient to carefully watch the area of skin, and if red bumps appeared, to come in immediately because it could be shingles. As it turned out, the patient checked their skin every day and was able to notice the shingles early, so we could start treatment right away. For areas like the back or legs, many people don't notice the rash or bumps even if they feel pain, unless they check carefully. Also, sometimes the rash appears after the pain starts, so please make a habit of checking the painful area every day with a mirror or something similar. Next question. The question is, can shingles be transmitted to other people? This is also a common question. The answer is, in most cases, no. As I mentioned earlier, shingles is caused by the reactivation of the chickenpox virus. That's all it is. So it's not something you catch from someone else, it's the virus you already have becoming active again. However, since the shingles virus is the same as the chickenpox virus, people who have already had chickenpox won't get infected with the shingles virus. But if a child or adult who has never had chickenpox comes into contact with someone who has shingles, they can develop chickenpox. That's why infection control is important, especially families with children should ensure kids don't touch the shingles area or share towels to prevent transmission. It's important to follow basic infection control measures, like making sure the person with shingles bathes last and thoroughly disinfects their hands. Next question. If you've had shingles once, you don't need to get the vaccine, right? I often get asked this question, and as a common misconception, some people mistakenly believe that if you've had shingles, you won't get it again for 3 years. But that's not true. Even if you've had shingles once, there's always a chance it could come back at any time. For those who have had shingles, if you gather 100 people who have had shingles, statistically about 1 person per year will have a recurrence. So, as I keep saying, there's always a chance it could come back at any time. Even if you've had shingles before, the shingles vaccine is definitely effective. Of course, it's not a cheap vaccine, but if you had severe pain and never want to go through that experience again, I think it's a good idea to get the shingles vaccine at any time. Here's the last question. People often ask which department to visit for shingles. If you have a primary care doctor or someone you trust, it's fine to start with them. Shingles is common, so internal medicine or most departments can diagnose and treat it. Many doctors can help, especially if you lack a regular doctor. If you're wondering where to go in that case, basically dermatology is the specialty, so it's a good idea to visit a dermatologist. And for those who suffer from a long-lasting pain after shingles, known as postherpetic neuralgia, pain clinics can also be a strong ally. In many cases, you'll be referred to one, but if you're struggling with pain, I think visiting a pain clinic or a department that specializes in pain is also an option. What do you think? This time, we've covered everything you need to know about shingles. Characteristics of shingles and dangerous shingles. I explained the vaccine and its after effects simply from a doctor's perspective. If you or your friends or family had symptoms, please let us know. It could help others. At YouTube Medical University, we not only discuss treatments for illnesses, but also how to prevent them. We focus on prevention methods as well, and we share information responsibly while presenting data. I believe it's very important to have a reliable source of information so you can live a vibrant life even in the later years. If you like, please subscribe to the channel and check out our new videos. I'll see you in the next video.